Hello everyone, thank you for tuning in today. In this video, I will be explaining the congenital heart defect, Truncus arteriosus, and the corresponding surgery, which is Truncus arteriosus with or without arch repair. So if you are interested in learning about this type of congenital heart defect and its corresponding surgery, please keep watching. So here we have a picture of a normal heart, and then to its side we have a picture of a heart with Truncus arteriosus. Truncus arteriosus is a rare type of congenital heart disease, meaning that it is present at birth. There is a single main blood vessel, which is referred to as a common trunk, rather than the normal two carrying blood away from the heart. Instead of having a separate pulmonary artery to carry blood to the lungs and aorta to carry blood to the rest of the body, a baby with Truncus arteriosus has just one blood vessel leaving the heart, which then branches into other blood vessels. Blood from both ventricles of the heart is mixed, resulting in a situation in which some oxygen-rich blood travels needlessly back to the lungs and some oxygen-poor blood travels to the rest of the body. Babies with this condition may have a bluish tint to their skin, lips, and fingernails. In most cases, Truncus arteriosus occurs in conjunction with a missing upper portion of the wall between the ventricles of the heart, which is known as the septum. This is called ventricular septal defect. Now that I have established a good understanding of what Truncus arteriosus is, I will be providing an overview of the corresponding surgical procedure. So as a reference, I will be using a video from CincinnatiChildren's.org that describes Truncus arteriosus to explain the surgical procedure of Truncus arteriosus with or without arch repair. The surgical repair of Truncus arteriosus with or without arch repair is undertaken in the first week of life and requires performing two major procedures at the same time. And as you can see, this is a heart that contains Truncus arteriosus. So again, Truncus arteriosus refers to a common trunk that includes both the pulmonary artery and the aorta. So here is another diagram that just shows the issue with a heart containing Truncus arteriosus. Here is the aorta, the pulmonary artery, and the common trunk that contains the aorta and the pulmonary artery. And again, we've got a heart with truncus compared to a normal heart. And as you can see, the heart with Truncus arteriosus has this common trunk. And the normal heart has a separate aorta, which is located right here, and a separate pulmonary artery. So this is a diagram of a heart with Truncus arteriosus. Most babies with truncus have a ventricular septal defect, like I mentioned earlier, which is just a hole in the septum. Alright, so the septum is a wall dividing the right and left sides of the heart, and it keeps the oxygenated blood from mixing with the deoxygenated blood. So when there's a hole in the septum, like here with the ventricular septal defect, it really defeats the whole purpose of having a septum there and separating the deoxygenated blood from the oxygenated blood. Alright, so this bluish purplish mass right here represents the blood. And the hole or the ventricular septal defect between the bottom chambers allows blood to mix before entering the common trunk. With this being said, the first procedure is necessary to close the ventricular septal defect or the hole located in the septum. This is called a ventricular septal defect closure. So again, the purplish, bluish mass right here represents the blood. And as you can see, the mixed blood then goes to the body and the lungs. So through the common trunk that is located right here, the aorta distributes the mixed blood to the body, and the pulmonary artery transports the mixed blood to the lungs. So in terms of the surgical procedure, now the hole, or the VSD that I was talking about earlier, is closed using either one of two materials, a Zacron patch or pericardium, which is the outer lining of the heart, and it is up to the surgeon which one that they prefer to use. The next step is proline is then used to stitch the material to the septum, resulting in the hole being closed. And this is a picture of proline right here. It is blue in color and is similar to fishing line. So a lot of people may want to know, why is it so important that this procedure be done? Why can't the heart be left the way it is? And the reason that this procedure is so important is because as the baby ages, the blood pressure in the lungs drops. And this results in too much blood going to the lungs and causing congestive heart failure eventually. Alright, now the second procedure is needed to separate the blood flow to the body from the blood flow to the lungs. Okay, so here I've got 3 diagrams of a heart with Truncus arteriosus undergoing the surgical procedure, and the heart labeled number 1 is just the heart before surgery. And in other words, the pulmonary artery is disconnected from the aorta, as you can see in diagram number 2. Now, once the pulmonary artery is separated from the aorta, this will of course leave a hole in the aorta. So this is where the aorta should be right here, and it just has a huge hole, like a huge space in here. Now, if you would look over at diagram 3, another patch of material is then used to close the hole left in the aorta. So now there is no hole in the aorta, whereas before there was a huge gap. Now, all of this results in the pulmonary artery not being attached to anything. So this is a pulmonary artery right here, and as you can see, it's kind of just off to the side by itself. With that being said, what we need to do is make an incision in the right ventricle into the muscle and make a connection from the right ventricle to the pulmonary artery. So here is the incision, in the muscle of the right ventricle, and it needs to be connected to this hole in the pulmonary artery. And will be used to make this connection is called homograft. Homograft is a cadaver pulmonary artery and valve. It is basically a tube with a valve in it. So here's a homograft right here. And using the homograft, a connection is then made from the right ventricle, which is right here at the bottom, to the pulmonary artery using a homograft conduit as the connector. So again, this is where it would connect to the pulmonary artery. So essentially, we are recreating the connection from the right ventricle to the pulmonary artery using the cadaver homograft. And right here is just another picture of what the homograft looks like. So here is the right ventricle where it would be attached to the pulmonary artery right here. And there would be no more common trunk. Now, basically, in a nutshell, that is a repair. On a scale of complexity, it is definitely a more complex form of surgery, just because, as you can imagine, some operations just require the closing of a hole in the heart, which is pretty simple. This surgery is more complex because there is a deattachment to structures that were not meant to be bound together, and there is a creation of structures that are not present. The incision that is made is an up and down incision called a sternotomy incision. It goes from the top of the breastbone to the bottom of the breastbone, so it's just kind of like a vertical line. A saw is used that is meant for cutting through the bone, and also a heart-lung bypass machine is used to take over the circulation of the baby while the operation is being done, because the heart has to be stopped in order to open it to find the hole, and also in order for the patches to be put on the aorta, of course, and to insert the conduit from the right ventricle to the pulmonary artery. I hope that this video helped better your understanding of Truncus arteriosus along with its corresponding surgery, and thank you for watching. Bye.